Hey, you've spent over $30,000 on functional medicine certifications, but your bank account does not reflect your clinical genius. Why? Because the most dangerous place to be in 2026 right now is being fully trained in your certifications and continuing education, but you're half implemented. Okay, so I'm Dr. Zac Watkins, and today I want to show you why the next certificate is actually your biggest bottleneck. You went to school to be a doctor, not a professional student. So why are you still buying courses instead of building a practice? Most functional medicine chiropractors are sitting on a gold mine of knowledge, but they're just running their office on an outdated 2015 model. So let's talk about the certification trap and how to finally break out of it. Stop buying functional medicine courses. Seriously, if you're not seeing the revenue you want, it's not because you don't know enough, it's because you don't have a process. So today I'm going to break down the 3 signs you're overtrained and under-implemented and exactly how to fix the front end of your practice. Okay, quick. So first of all, we want to talk about the information versus implementation gap. I've been there, I get it, I understand. Because most doctors are thinking that the lack of their revenue is usually reflective of a lack of their knowledge. And I've been there where you're not seeing the results that you want. So we try to go to more courses, certifications, weekend programs, all that stuff, which is actually very good. But we're starting to wonder, why are we not seeing the reflection in our practice? Literally, there was days where I thought, I have this much training, therefore I should be busy, no problem. It didn't work back then in 2008, 2010, and it's really not going to work now. So the reality is you don't have really a doctor problem. You have more of a front-end model problem. Okay, you're trying to run a high-level, profitable, but also impactful functional medicine practice on a lower level, typical chiropractic infrastructure. Okay, so there's usually going to be 3 signs of this half implemented practice, and these are the ones that I typically just see talking to other colleagues and people in our industry. Okay, so the one is going to be we call it the meet and greet consult. You're running your initial visits. We're talking about functional medicine here. You're running your initial visits more like a social hour instead of a leadership event. What do I mean by that? I think it's, at least my observation, these appointments are going to be more, doctors use them as, I think it's because they lack confidence, honestly. It's because they have these conversations, they're kind of dabbling, I'm not sure. Should I ask this list of questions? Should I ask this list of questions? You know, then it kind of turns into more of like a social event and a conversation. There's no really like, what's the next step? So instead, I really encourage you to start thinking of it as you are a leader. Okay, you are a leader in this practice, you are a leader to these people, and you're just gonna have to step out and say, here's what we see, here's your next steps. Okay, it may not be an issue for you, but these are just one of the big ones I see. The second one is a really big one, and I'm gonna dive into this a little bit more, but it's called the data dump. Okay, you're showing patients all this raw lab data instead of what I call is a lab story. And the reason we say this is because I've been through all of these situations where you're in practice and you're knowing and you're learning, you're being taught so much. Therefore, we start teaching our patients stuff. We start drawing the Krebs cycle. We start drawing little mitochondria and how they make energy or don't make energy. A big one for me was I always used to draw the adrenal stress patterns, 1, 2, and 3, and what happens with each. Now, those are good to get your point across, and I think good in like lectures to help get points across. But when you have appointments and people are paying you for a result, you're kind of losing money. You're losing your time, especially if you charge, let's say, $50 per half hour and your appointments go an hour. You just lost, $350. So I call this a lab story, and I'll dive into this in a second. But the only third thing that I see quite often is this kind of like a default to their appointments, where you're thinking more in like visits versus more of a transformation. So we like to use 12-week transformations. I've experimented with this personally in practice. This is why we teach doctors a certain way. We've done programs that were a month long at a time with renewals, We've done practice programs that were, let's see, 12 months long, which are more like the long extended, because we know it's going to take time to renew things, but patients can't buy into that long period. A month is just way too short. 6 months is a good happy medium, but we always promote 3 months. 3 months is a good time to do a start, a finish, a repeat, and then move them into like a more maintenance or wellness program. So quit thinking about visits where it's like, hey, let's try this test, come back and we'll try later. I also see a lot of docs, especially chiropractors, do this too, where they have access to a lot of good functional medicine tools, food sensitivity, detoxification, organic acids, whatever it may be, but they're using it like, hey, let's try this test. Let's look at the results. You feel good because you did a test. It's functional medicine. You got paid cash, but there's no follow-up, and patients don't follow up, and they end up going somewhere else. So think more of like a transformation period, okay? So let's get back really quick to the lab story. What do I mean by a lab story? So you got to stop explaining physiology. It's cool that you know it all, and there's lots of great knowledge there, and I think that's great, but the patient doesn't care about that. They don't care about, again, the Krebs cycle. They're not even going to remember it. I barely remember it. When you spend like 20 minutes explaining how different parts and different physiological concepts work, you've probably already lost them. I've seen this in practice with myself, but also maybe team members I've had, where we spend, let's say, an hour appointment and we're reviewing 50 minutes of it. We're explaining the intricacies of homocysteine in the body. And then at the end, patients are like, what's homocysteine again? And it disconnects everything, okay? So this is really going to be turning into, that's like a lecture. We don't want that. We want to turn this into a leadership event. So you want to connect I call it the markers to the misery. It's very dramatic, but markers to the misery. So the implementation means you're going to tell a story, right? So instead of saying like, hey, your ferritin is at 12, again, what's that mean? Your iron stores are empty. This is exactly why you feel like you're walking through mud every day starting around 2 p.m. Okay? Connect the data to the story or the misery, the daily plan. That's going to resonate more. When we find doctors that we teach to do that, convert patients better. Not sell them like salesly. If you want to get sleazy like, then yeah, you got to push harder to really convince them. But when you show them data points that really tie to their concerns, it makes the next step so much easier for them, okay? Finally, give them like a 12-week finish line, right? Don't say, let's see how you feel in a month, follow up in a couple weeks, check in when you want. Be the leader and say, we're on a 12-week sprint. We're gonna fill those stores back up. Talk about ferritin. We're gonna retest again in June, and we're gonna prove that we hit the target, or we're just gonna course correct. This isn't about good or bad. I tell patients this all the time. This is not good or bad. This is more about, are we making the transition to the direction that we want to go? Are we still going north, basically? Okay, that's a plan they can follow. All right. So I say this because these are commonalities I see with practices, with doctors trying to get into practice, and the thinking is I just got to spend more on education, and the education is good, and it's never going to go away. But in this knowledge-based economy where knowledge is at everybody's fingertips, patients are going to be looking more for doctors who can empathize with them and give them a plan and be their coach, basically. Okay. So if you're tired of being the best kept secret in your town and you're ready to actually build a business around the training that you already have, let's see where we can get those gaps closed. Okay. Comment or DM me personally the words clarity quiz right now, and I'm going to send you a functional medicine practice diagnostic quiz. It's going to give you basically a personalized roadmap of where you're at, where you want to get going, so you can stop guessing. I'm going to help you along the way. That's my goal. Make 2026 a great year where you excel and separate yourself from your competitors. Thanks. Hey, you